Thank you very much, Madam Chair. I rise in strong opposition to the underlying very reckless bill, H.R. 1216. The Republicans, and we've heard this over and over again, they want to destroy and to deny seniors long-term affordable health care by eliminating programs that are training the future health workforce of our country. This legislation is really part of an ongoing Republican attack on Medicare under the guise of deficit reduction and fiscal responsibility. It really is about privatizing Medicare, and of course that means that there will be some winners and there will be some losers. The Republican plan to end Medicare threatens the healthy and secure retirement that we promised American seniors. In fact, an end to Medicare is an end to a lifeline that millions of seniors rely on. Medicare gives peace of mind to millions of Americans who pay into it all of their lives. The Republicans want to give aging Americans a voucher, mind you, that will not come close to covering the cost of health care instead of maintaining and improving Medicare. Sure, waste, fraud, and abuse must be addressed wherever we find it, including the Pentagon. But we disagree with the Republican agenda that the program must be killed. The Republicans want to end this program when millions of Medicare beneficiaries are struggling to make ends meet, and when we know that Medicare-eligible beneficiaries will double over the next 20 years. Republicans have the wrong priorities, focused on letting the rich get richer on the backs of the middle class and the most vulnerable in our nation. Under the guise of reform, Republicans would increase costs for seniors and cut benefits while giving tax cuts to millionaires, subsidies to oil companies, and sending desperately needed jobs overseas. If the Republicans get their way, millions of seniors would immediately begin paying higher costs for prescription drugs. The impact of killing Medicare will be the most severe on vulnerable and underserved populations, including our seniors of color, while negatively impacting all seniors who rely on Medicare to protect their health and economic security. An end to Medicare is really an end to a lifeline that millions of seniors rely on. If Republicans have their way, millionaires will continue to get big bonuses while millions of Americans fall deeper into poverty. Madam Chair, approximately 43.5 million Americans were living in poverty in 2009. But did you know that nearly 4 million of those are seniors? Given our challenged economy, we can't expect these numbers to have improved since 2009. Medicare is part of a promise made to hardworking Americans to ensure that they would not lack the security of having health care. And so rather than stand silently while Republicans destroy a program that protects vulnerable populations, we are here to speak up and stand up for our mothers and our fathers, our grandmothers and our grandfathers, our aunts and our uncles, and yes, our young people and our children, and to be their voice in the House of Representatives. We are here to declare that Medicare should be protected and improved to protect our nation's seniors and most vulnerable populations, and we're here to say that we want to secure it for future generations. Ending Medicare really does end this promise and this security for millions of Americans today and here and in the future. So we're here today to defend Medicare and the support that it gives to our seniors. We must ensure that those who have worked hard their entire lives strengthening our nation have the health security that they need and that they deserve in their later years. Thank you, and I yield the balance of my time.
Gentlewoman yields back. Gentleman from Texas. Gentleman from Texas is recognized.